Good morning, everybody, and welcome to the second day of this summer school on the food safety aspect of integrated food systems. This second day is focused on chemical mixture. And I think this is a very intriguing topic. And the idea when we organized this second day was to try to make the day exciting for the audience. All the speakers are experts in the topic they will show you, and I'm sure that all the presentation will add pieces to the whole puzzle we want to show you. Anyway, we can welcome all the questions to complete any part of the topic that is not enough clear or enough well explained based on your point of view. I am Paola Battilani, a professor in plant pathology from University of Piacenza, Università Cattolica, one of the organizers of this summer school. And I am happy to introduce the first speaker, which is Jean-Loup Dorne. Jean-Loup Dorne is from EFSA. He is working in EFSA since 2006, but he has a background at the University of Southampton. Let me say that he is a true expert on the topic he will show you, and he worked on chemical mixture, also working on new approaches to assess the impact of chemical mixture, which is a quite challenging topic. So please, Jean-Loup, the floor is yours.
Thank you very much, Paola. And first of all, I'd like to thank all the colleagues who invited me from the University of Parma, the University of Piacenza. So today I'm going to talk about the work of EFSA's Scientific Committee on Harmonized Methodologies for the risk assessment of mixtures. To use the WHO terminology, we call this topic risk assessment of combined exposure to multiple chemicals. So first of all, I'd like to start with a little icebreaker that we use very often when we describe the topic, being in Parma. It seems like, okay. So if you go to a restaurant in Parma, you will taste all these wonderful food, tortelli di zucca or tortelli di ricotta, di erbette, and you may have a piece of meat after that. And at the end of your meal, you may want a digestive to digest. So you have the choice very often between limoncello, bargnolino, or nocino. And of course, some of our experts in the mixture working group had the unfortunate experience to try the three of them in one evening, which resulted in a headache the following morning. As we can see, the potency of nocino is a little larger, and the conclusion of the experts was that nocino may be a hazardous mixture, and do not combine them together as a mixture. That is a true cocktail effect. So to go back a little bit on the development of those harmonized methodologies, in 2019, the Scientific Committee of EFSA published a guidance on harmonized methodologies, not just for human health, but also to look at methodologies to deal with mixtures in the animal health and the ecological area. Basically, this harmonized guidance explores, first of all, two different types of approaches for mixtures. The whole mixture approach, where, for example, you may have a petroleum effluent in the sea, that would be a whole mixture, hundreds of compounds together, or the component-based approach, for which each component of that mixture are known and defined. Of course, the guidance document includes methodologies to deal with interactions, and for every steps of the risk assessment, the questions you may have, the problem formulation, exposure and hazard assessment, and the combination of the two, so to speak, risk characterization. Finally, we have a reporting table so that you can summarize the outcome of this risk assessment. I will now go into details for each step of the process. First of all, the harmonized framework. Again, problem formulation, hazard assessment, exposure assessment, risk characterization, and a number of factors influencing each of those steps. A very important aspect before we start also are the tiering principles. Basically, the more data you have, the more sophisticated you may be able to perform your risk assessment. So this is what we call tiering. And here you can see that you may run a very simple risk assessment or using very simple methodologies when you don't have so much data. And of course, the more data you have, the more complex it can be. And the more complex it is, the lower the uncertainty, of course, when you have all these data sets. But I will exemplify this later in each of those steps. Problem formulation. We have a question. Let's say I have to assess the risk of heavy metals in food for human health, let's say in children. First of all, we need to describe what the mixture we're talking about. So do we know the composition? Let's say 5 heavy metals. Do we have data available for each of those components, or are we talking about a whole mixture? In this case, if we have 5 defined heavy metals, we do know the composition. Is co-exposure likely? Do we have evidence that we're co-exposed to all those 5 heavy metals? And is there a co-effect? Is there evidence that these cadmium, lead, and mercury are additive together, for example? If none of this is relevant, then we can simply stop. So what is the question we need to answer? What is the species we are dealing with? And what are the multiple chemicals? Then we have a so-called conceptual model. How do we deal with this for risk assessment? So questions, terms of reference. The sources of the chemicals. Are we dealing with food? Are we dealing with food plus air, or plus some sources, some other sources like dermal exposure pathways? Species, potential subpopulation. Is there a regulatory framework that constrains the way we can perform this risk assessment? What are the methodologies we're using? And from that, we produce an analysis plan and we proceed with the risk assessment. Of course, this is an iterative process, and this can always be updated and modified in an iterative manner. Exposure assessment. Once we know what we have to deal with, first of all, we have the occurrence data, how much of the chemical is in the food, let's say if we're dealing with food, how much of this food is consumed, and we combine the two together for the exposure assessment. As I mentioned earlier, we're applying tiering principles. We may have very little occurrence data, for example, for emerging contaminants we've never assessed. So we may use default values or permitted levels, that would be the tier 0, or we may have a lot of data, all the way to having individual co-occurrence data, tier 3, and individual data for the consumption. And that would be the highest tier, of course, with the lowest uncertainty. So the amount of each chemical in the food, how much food is consumed, and you combine the two together to get your exposure estimates, what we call exposure metrics. For the hazard assessment, and here I am exemplifying only for the component-based approach. We discussed 5 heavy metals, so we need to confirm the components from our group. How do we group them? Let's say we're dealing with heavy metals which are targeting the liver. Excuse me. So how toxic are those chemicals? We've assessed them individually. Now we're assessing them as mixtures. So we're collecting the toxicity values for each of those chemicals. we check whether they may interact together, so synergistic effects, for example. So collect the available hazard information, evidence for combined toxicity. Can we apply the dose addition assumption, meaning the effects are additive when they are combined together? Any evidence of interactions? We then collect all the toxicity values and summarize them for each component. We list our assumptions, potency, for example, dose addition, interactions, and the uncertainties. Once we have done the exposure and the hazard assessment, we can then proceed with the risk characterization. And here, you summarize your exposure metrics and your hazard metrics. We're talking about whole mixture, we're talking about component-based approach. From the example I used, the 5 heavy metals, we're talking about component-based approach. Decision points from your analysis plan, assumptions. Here we know they're additive. So we combine the exposure and the toxicity data for all chemicals to raise the risk values. We summarize the risk characterization results, so balancing the exposure and the hazard. We always start with a fit-for-purpose methodology, again, based on problem formulation and available data. How much data do we have for the exposure and for the hazard? A range of methodologies are available. We then summarize the risk characterization results, and of course, we will interpret them. Are we identifying that there is a health concern, or if we are dealing with the environment, an environmental concern? If no, we can stop. If yes, what is next? First, we may refine the methodology we've used for the risk assessment, or we may discuss with the risk managers on how to reduce the exposure. Once we have done that, we then summarize the whole process in this reporting table. Again, you have your problem formulation, you have your exposure assessment, hazard assessment, and risk characterization. And all these sub-steps within each of those are basically summarized. For the problem formulation, description of your mixture, conceptual model, methodology, and analysis plan, and so on. For the exposure, we characterize the whole mixture, components, summary of the occurrence and the exposure, the tox values for the hazard assessment, reference points, reference values, summary of hazard metrics, the combination of the two for the risk, exposure and hazard metrics, what is the methodology we're using, risk characterization approach, and the summary of your risk metrics with associated assumptions and uncertainties. So from this guidance document I've just presented, we then wanted to illustrate on how to implement such methodologies in practice for EFSA panels. For example, human risk assessment of multiple chemicals across panels when we deal with pesticides, contaminants, food additives, or feed additives in the human health area. And this is the first technical report that's illustrated on my screen. And then when we're dealing with animal health risk assessment, quite a lot of work being done in the feed additive area to replace the use of antibiotics. We're looking at animal health risk assessment of multiple chemicals in essential oils for farm animals. And this report illustrates on how to apply that for animal health. Forgot to mention that, of course, these documents also include on how to refine those methodologies, including the use of, for example, pharmacokinetic modeling to refine the way we calculate risk metrics. Another large piece of work, actually Paola was part of this consortium also together with Professor Chiara Dall'Asta and other colleagues, Piacenza and also Armando was also part of this work. So looking at mycotoxin mixtures in food and feed. And here I've illustrated a number of publications, but specifically the occurrence and co-occurrence of mycotoxins in cereal-based feed and food. And here you can see with different colored codes, the realistic co-occurrence of 3 mycotoxins, Dorne, zearalenone, and nivalenol. Again, you have your co-occurrence and your consumption patterns. We collect the hazard data for each mycotoxins, And here we're using EFSA's Open Food Tox database, which contains the summary of hazard metrics for all substances EFSA has evaluated since its creation in 2002. And here, as an example, we've used for the risk characterization a methodology called combined margin of exposure applied to the human health and for farm animals. But I invite you to read the guidance document if you want more details about those methodologies. Of course, I do not have time to illustrate them all in this presentation. So recently, we went on to producing a second guidance document, and this document aims to basically explain on how to group chemicals into assessment groups for performing a mixture risk assessment using component-based approach for human risk assessment. So I will try to provide you with first the background. Of course, if we are to perform this risk assessment for mixtures, ideally we would like to know each component. Very important applications to set what we call cumulative assessment groups for human risk assessment of pesticides. This is a request from our main customer, DJ Sante, but it's also very relevant to other panels in EFSA. And Bruno, in his presentation, will also illustrate on how to do this for pesticides later on this morning. So other examples, the contam panel, we're grouping contaminants. We can think of mycotoxins, perfluoroalkyls, brominated flame retardants, and so on. The FEEDAP, again, the mixture risk assessment of essential oils I've just illustrated for animal health. The food additive and flavoring FAV panel, we can think of smoke flavorings. And here we may use chemical properties also to group using the read across ECHA guidance document and the OECD QSAR toolbox, depending on the amount of data available. And overall, this will support all panels dealing with chemical risk assessment and who have to perform a mixture risk assessment in their context. Seems like the keyboard is not responding anymore. Apologies for that. Okay, so thank you. The terms of reference. So this guidance document aims to, again, let's say, define scientific criteria for grouping those chemicals. We always start from the science, so scientific principles and relevant cross-cutting guidance that we may have. What is the context of your risk assessment? Are you setting priorities? Are you dealing with an urgent advice or a pre- and post-market risk assessment? Pre-market, for example, would be, of course, pesticides, pre-market, or the reassessment of the pesticides once it's been on the market. That would be post-market. Or another example of post-market would be assessment of contaminants, mycotoxins or heavy metals, brominated flame retardants. The tiering principles apply to these documents and always fit for purpose scenarios, considering the available data. The more data you have, the more time you have, the more resources you have, the more sophisticated your risk assessment can be. Very important, the use of prioritization methodologies to, let's say, prioritize the chemicals when we have a large amount of chemicals or when we have limited time. And these are so-called risk-based and exposure-driven, and I will illustrate them in the following slides. What are the relevant EFSA activities and international activities in relation to this specific topic? Of course, we always try to harmonize, for example, harmonize with the WHO and other international partners to avoid duplication. And actually, as we speak, this document had been published in May for public consultation, and we're currently finalizing it and writing the report of the public consultation. So it contains introduction general principles. One of the key scientific criteria for grouping are so-called hazard-driven criteria, and here we're talking about toxicology, basically, prioritization methodologies, and recommendations for the future. A number of annexes, and in the interest of time, I will not go into details here. So straight into some important basic principles. Ideally, we would like to understand how these chemicals affect, let's say, body targets or body organs, such as, for example, the liver. And this is what we call the mode of action. We have an exposure, which is what we call an external dose. Of course, the chemical goes inside the body and it gets metabolized, distributed, excreted, and so on. And this is what we call the toxicokinetic process, what the body does to the chemical. So we go from external dose to internal dose. We eventually reach target organ concentrations. Once you've reached the target organ or the target cell, you may have a binding of this substance to its molecular target, and that is the molecular initiating event. And then this may lead to an adverse outcome through a number of what we call key events. And that would be what the chemical does to the body, which is the toxicodynamics. Toxicokinetics, what the body does to the chemical. Toxicodynamics, what the chemical does to the body. Within that, a lot of research is going on in this field to define all these molecular initiating events and key events leading to adverse outcome, and within the framework of what we call adverse outcome pathways. In this context, and coming back to our grouping, using hazard-driven criteria for grouping chemicals, there's a G missing in grouping. So here we have a top-down hierarchical process to group chemicals based on mechanistic understanding, either a mode of action or an adverse outcome pathways, as illustrated in my previous slide. What are the chemicals you're considering? Defined in your terms of reference. We need to pass the gatekeeper step, meaning how many chemicals do we have? Is there a co-exposure? Is it likely? Is there a co-effect? Is it likely? Ideally, we would basically use the common mode of action or the common AOP, adverse outcome pathway, to group the chemicals. And that would be the best we can do because we understand the mechanisms of toxicity. That would be our gold standard. When we do not have this type of knowledge, and actually most often we currently do not have this type of knowledge, we may move to use a common toxicological effect as the basis for this grouping. And again, if we don't have such data, we may use common target organ and system. If we cannot group them, they may be excluded from the assessment group. When we do not have data, we are increasingly using what we call in silico models or structural features of chemicals. And we can also use these methodologies to group the chemicals. But again, I do not have time to go into too much detail. What's important here is to understand the principles that mechanistic understanding is our gold standard. And then we go down into the tiers. Here we start with the highest tier as the gold standard, and then we will then have to see what we have available. And of course, when you start with a common mode of action, the uncertainty is low because we understand that. As we go further down, adverse outcome or target organ, the uncertainty increases. So this approach has been implemented by the colleagues working in the pesticide unit. For example, organophosphate substances can be grouped by their well-known mode of action, acetylcholinesterase inhibition, a bit like what a number of snake venoms, that's what they do. They paralyze you. So that is through blocking the acetylcholinesterase inhibition. Some other effects, for example, on the thyroid, hypothyroidism, functional alteration of the motor division of the nervous system, or craniofacial formations. So these can be used to basically group your pesticides before you perform the risk assessment itself. So 3 examples from a very detailed risk assessment performed again by by our pesticide colleagues in collaboration with a number of scientists, looking at risk characterization of pesticides on looking at acute effects on the nervous system, chronic effects on the thyroid, and again, the acetylcholinesterase inhibition. How do we prioritize these chemicals, when we have so many of them? So again, the first step is we have either an assessment group. Let's say I'm back to my 5 heavy metals in food. And we know that they are targeting the kidney. So this is defined from my hazard-driven criteria. I understand the mechanism of toxicity. Or I may have 500 chemicals that have just landed on my desk. DJ Sante wants a risk assessment for this. And they say, please assess all the brominated flame retardants with all the mycotoxins. And here we have to think, how the hell am I going to do this? So first is, do I have hazard metrics for a common effect on organ system? I have a number of contaminants that are naturally produced and others are anthropogenic. Mycotoxins are natural, the others are anthropogenic. What is the common mechanism? 20 of these mycotoxins target the kidney, 20 of these contaminants target the kidney. Another 20 mycotoxins target the liver, another 20 of those contaminants target the liver. I already intuitively have 2 groups. So the first thing we do is, what is the contribution of each of those substances to the combined risk? And if they have no contribution, maybe we can actually first class them as low priority chemicals. If I don't have hazard metrics for the common effect, I may use the EFSA Open Food Tox database and just pick the toxicological endpoint that we use to set the protective level, the safe level. So the hazard metric for the critical effect. And here I can again calculate the contribution of each of those single chemical to the risk metric for the single chemical itself. So are we talking about a risk which is about 10% of the safe level, or are we already at 100%? And again, if there is no contribution, this chemical could be classified as low priority. When we do not have toxicological data, for example, we may have to assess breast milk contaminants. And here we can use, instead of using the hazard-driven criteria, we can use actually exposure-driven methodologies. And there we can calculate the probability of co-exposure. To prioritize the chemicals, again, they can be low priority chemicals because we've excluded them, or they can become prioritized, put in an assessment group, and here then we may either have the final assessment group, or we may dig into the data sets and try to refine the way we've actually put them together. And we would refine them using the hazard-driven criteria, past the prioritization. So some examples here on prioritization methodologies for pesticides, but I think Bruno will explain this in more detail. Again, we may have the critical effect, the no observed adverse effect level, for example, for the pesticides, or we may have cumulative assessment groups defined for specific effects. We can screen for the individual pesticides, combining the toxicology and the exposure, okay? We define our high priority substances. We can screen the risks for the different organs we have, for example, liver toxicity, thyroid. We then get our high priority organs, and we can then produce, again, cumulative assessment group for specific effects. I wanted to touch upon some examples of open source model we are developing and that are relevant to the field of mixtures. So, of course, one of the questions is that mixture toxicity can involve interactions. And here we have to check if those interactions may impact on our risk assessment. And most importantly, if they occur at current levels of exposure. So we integrate, of course, this understanding in the risk characterization. You may say these two compounds together the toxicity increases by 5-fold. So I may use an extra uncertainty factor of 5 because I can quantify the magnitude of that interaction. Or we may use biologically based models, which are kind of illustrated simply below. Let's say we have two chemicals, food chemical A, again, it's coming into the body, external dose, it goes inside, it goes to a target organ. Now we understand that actually there's a second chemical coming in, and this chemical is blocking the metabolism of chemical A. Now, two possible scenarios if the metabolism is blocked. Is the metabolism detoxifying the chemical, or is it bioactivating the chemical? If the metabolism is blocked and it's detoxified, metabolism is detoxifying, then we may have an increase in toxicity. If, on the other hand, the metabolism was bioactivating the substance to a toxic form and it is blocked, we are now lowering the toxicity. So here we can define first the combined toxicity. We can look at these interactions. Is the chemical potentiated by another one that's blocking its metabolism? Or is there a direct synergistic effect? Or is the toxicity becoming lower and do we have an antagonism? And of course, ideally, when we understand this and we can quantify, we can integrate such a magnitude in the risk assessment process. So I wanted to give you the example of the famous or infamous example of melamine and cyanuric acid. And here is the mannequin piece in Brussels. Why did I use this picture? Melamine and cyanuric acid are toxic to the kidney function. So what happens is that melamine itself complexes with uric acid, and we end up with the kidney stones. However, this complex is labile. It's not covalent. So basically, it's there are a number of ways to treat these symptoms in clinic. When melamine and cyanuric acid are together, they form a covalent complex, which is, let's say, far more toxic for the kidney than melamine on its own combined with uric acid. And this has been well characterized, and you can see the complex on the right-hand side of the slide, the cyanuric melamine in the glomerular tubule of the kidney. As it happens, the toxicity of melamine and cyanuric acid is relatively high let's say, in rodents and in humans, but the most sensitive species is the fish. Therefore, we started to investigate, can we develop a biologically based model to understand and model first the formation of the complex in the kidney, in the fish, in the trout here, and can we model the dose response of this complex formation? And here you have a little scheme providing you the basis for this biologically based model. Another interesting example, I have high cholesterol and I take grapefruit juice in the morning. And to treat my cholesterol, I take statins. Those statins will lower my cholesterol. However, grapefruit juice will block the metabolism of those statins, meaning that the statins will remain in my bloodstream. And actually, if I drink this grapefruit juice every day, taking the statins, this could potentially kill me because the blood levels of the statin will reach a toxic level. And this happens with a large number of substances. So here we're talking about grapefruit juice inhibiting in a competitive manner one of the most important drug metabolizing enzyme of the liver, CYP3A4. On the other hand, in Italy, it's called Erba di San Giovanni, St. John's wort. It does the exact opposite. It induces the metabolism. So here we have a scenario where one substance is inhibiting metabolism and the other one is inducing it. we have quite a lot of clinical data on this for pharmaceuticals. And here what we can do is derive uncertainty factors from these human trials, and we can quantify the changes in the kinetic parameters and maybe use this as a conservative approach in risk assessment for inhibitors and inducers. This is why we called it the yin-yang of CYP3A4. On the one side, you inhibit, on the other side, you induce. Last example, here we're dealing with interactions. We do know that bees are relatively sensitive organisms, that they have limited capacity of metabolizing chemicals. So we went into investigating and classify the type of interactions we can see in bees. And what we can see is that the interactions and the synergistic effects are first of toxicokinetic nature. We are talking again about inhibition of metabolism. We do have limited data. However, we were able to calculate the magnitude of such interactions for acute contact toxicity. We still need to address the co-exposure dimension. The endpoint is, of course, mortality, and at least we have a starting point if we have to address these mixtures. Mortality as the common metrics for risk characterization. From this database, just to illustrate the use of in silico models, we could combine all the data to develop quantitative structure-activity relationship models to try to predict the nature of the combined toxicity. And here we're combining physico-chemical properties, but also structural features, and of course, the toxicity data itself. And that can be performed for a range of chemicals for which we do not have these data. Well, I think I would like to stop here and give you a little summary perspective. So the mixed tox guidance document provides, of course, a harmonized guidance document for the risk assessment of multiple chemicals. We have frameworks for each step: problem formulation, exposure assessment, hazard assessment, risk characterization, and a reporting table that provides you with a summary of the results of that risk assessment, applicable to human health, animal health, and the ecological area. The second document I described was scientific criteria for grouping, hazard-driven criteria. Again, do we understand the mechanism of toxicity of those chemicals? Or if we don't, do we have at least the target organ? And prioritization methods, the contribution to the risk, either of the mixture itself or the single chemicals. And if we don't have the toxicity data, we use exposure-driven approaches. As I mentioned, this document is under public consultation, and we're finalizing it, hopefully to publish the document in December. Just a few thoughts on future work in this area. The use of so-called new approach methodologies, such as QSAR methodologies or biologically based model, as I've illustrated, is an important area to explore. Dealing with interactions of relevance to the food safety area. Do they occur at the current exposure levels, or at least at what level would they occur? Again, physiologically based models and other biologically based models. Environmental risk assessment, just to illustrate, and I think my colleague Agnès Rortet yesterday gave a talk on bees, and we've explored how to basically perform a risk assessment for multiple stressors in bees, combining multiple pesticide residues, but also diseases and maybe nutrition. So here you have an example to look at if you're interested. It is published since May 2021. With this, I would like to thank you, and maybe I would give the floor back to you, Paola, and I think the question session will be after Armando and Bruno's presentation. Thank you very much.
Thank you very much, Jean-Loup. I think you did a very good job, and I think it is clear to everyone that the risk assessment for chemical mixture is really a very, very complex topic. I would like to mention some keywords from your presentation. I hope you agree on those keywords that are tiers approach. So we need to understand and collect information step by step because it is impossible to have at the beginning all the information requested. I think another keyword is grouping chemicals because we have so different compounds. And let me say, we have naturally occurring compounds, mainly mycotoxins, that will be considered in the next talks. But we have also chemicals delivered by human actions. And so the data we can have with the natural or with the human added compounds is completely different, because in nature we can have a lot of action that modify the compounds, and the speaker, Chiara Dall'Asta, will clearly show this relevant aspect of chemical mixture. The other points I think is a keywords is prioritization, because we need to have a priority when we manage risk assessment. Also in account of the possible additive effects or interactive effect or synergistic effect of compounds we have in the mixture. The other keyword I should suggest is available data and harmonization of data, because to do any kind of risk assessment we need data, and frequently we have not harmonized data collected without the aim of using them for risk assessment. We discussed a lot in the project, Jean-Loup mentioned, and I think this is a message to be delivered to the audience, because harmonization of data and clarify the objective when you collect data is really a crucial topic. So, sorry Jean-Loup if I tried to find out some keywords, but I think this is a good input for the other and a good screen to put the following presentation that will take into account the production chain, the dietary exposure, the biotransformation of chemicals, and the regulation. Because in this wide framework you defined, I think all the other topics will be perfectly included. I stop talking because it's the time of moving to the next speaker, but before I would like to remember to all the attendants that we have a question and answer session, and so they can ask questions through the chat. All the questions will be collected, and in the proper time I will ask the question to the speakers, and they will give you the requested answer. Thank you again, Jean-Loup, and I think we can move. Do you have any comment, Jean-Loup, before moving to the...
Well, no, I just wanted to thank you for the resume you provided, which I think is very useful. You've extracted some key points, which I think are very useful for the audience and for the next speakers. So thank you very much.